as the country continues to deal with the COVID-19 pandemic, other infections are slowly but surely creeping into the bodies of the vulnerable, leaving them at risk of adverse health effects that arise from lack of clear diagnosis. And in this week's special feature, The Silent Killer, Raquel Muigai explores the tuberculosis infection that has for a long time appeared to be a disease of the past, despite its present life-threatening risk.
Stitch after stitch, 37-year-old Ezra Njoroge has perfected the art of shoe repair at his base in Kangemi area of Nairobi. Ironically, however, the same cannot be said for his life, as his world came crumbling down 2 years ago when he was diagnosed with tuberculosis.
Nilikuwa na bibi akapotea na watoto wawili mapacha. Nilienda hospitali nikapimwa, nikaambiwa niko nayo, nikakuja na mandawa. Sawa, wakati huo ndio nilishikwa na wasimu wakaenda.
Ezra says his biggest challenge was falling ill frequently. He had just completed a 3-month sentence at the Industrial Area Remand Prison after being arrested for violating traffic rules as a conductor.
Nilipimwa nikiwa huko. Nikaambiwa inaonekana ikiwa kwa ubali. Sasa mimi sikuwa najua hiyo ni nini. Sasa mimi kutoka sikushughuli. Nikakaa miezi ingine karibu 5.
Ezra is among the 64% of males infected with tuberculosis in the country. The National TB Program 2019 annual report indicating that TB prevalence in men is twice as high as that of women.
In every 100,000, you have 426 people who have got tuberculosis. And out of that also, we are still missing them. They are still there in the community, walking around. They have not sought medication.
Tuberculosis, an airborne infection, is highly endemic and a major public health concern in Kenya. And despite the government making diagnosis and treatment free of charge in every public health facility, it still remains the biggest challenge in tackling the disease.
Kuna wengi ambao hawajakuwa exposed. Tuseme madaktari ambao hawajakuwa exposed kufikiria ya kwamba huyu mgonjwa akiugua akija kliniki yako kila wakati inaweza kuwa ni TB kwa vile umemtibu mara mingi na haponi.
Rapid diagnosis of TB and drug resistance is usually done through the gene expert machine. According to Nelly Mukiri, the head of the National TB Reference Lab, the tuberculosis bacteria can sometimes fail to present in the results.
The gene expert has a limitation where it picks 131 microunits of the bacteria. So if at all the sputum was coughed from a different alveoli or the pocket from the lungs and it doesn't have the TB bacilli, you can get a negative result. But it doesn't mean that that patient doesn't have TB.
That being seen in the life of 26-year-old Mark Mulango, who got his diagnosis in September 2020 after almost 4 months of pumping medicines in his body to treat his symptoms.
I went to different hospitals that is in Kangemi, and upon which they gave me some medicines, though they were not working for me. So different doctors, they were like just some bacteria in the body that are maybe making me to be this weak and this, like that, lacking the appetite.
General symptoms of active TB include unexplained weight loss, loss of appetite, fever, fatigue, and night sweats, symptoms that can mirror any other disease like gastroesophageal reflux disease or other fungal diseases.
Nakumbuka kuna mama fulani alikuja hapa kama amefura tumbo. Ungedhania ni mama mjamzito. Na huyu mama alikuwa na maji kwa tumbo. Tunaita ascites kwa kizungu. So kila mara alikuwa anaenda kwa hospitali kubwa, wanatap. Kila wiki wanatoa maji inarudi. So kuchukua history tukamwanzisha kwa madawa ya TB. Baada ya wiki 2 huyu mama alikuwa tumbo imepotea.
There are 2 types of tuberculosis infection: pulmonary tuberculosis that affects the lungs and extrapulmonary tuberculosis that occurs outside the lungs. Save for the general TB symptoms, those with extrapulmonary TB will have varied symptoms based on the area affected and the role of the organ in the body. It is for this reason that the National TB Program is advocating for active TB case finding, especially now during the COVID-19 pandemic, where some TB symptoms mirror those of a COVID-19 infection.
Anybody who comes to the health facility, even if you are a visitor, you are screened for COVID-19. Before you see a clinician, you are also screened for tuberculosis. If you have been identified to be a positive case of TB, particularly the TB of the lung, we do a contact tracing of all your contacts, your colleagues, your workmates, and then we screen them for TB.
However, stakeholders feel that the COVID-19 pandemic has in some way altered the gains made in the fight against ending tuberculosis in the country by year 2030. Ezra being an example of the challenges COVID-19 presented in matters drug adherence for TB patients.
Nilienda mara ya kwanza nikakuta milango zimefungwa. Sikurudi mara ya pili na nikakaa sana. Sasa hiyo ikanirudia mara ya pili ile shida nilikuwa nayo mbeleni, zile dalili. Kaona ni kama hizo tu sinanirudia.
As the government and other agencies work around ensuring that every person at risk of infection is diagnosed and treated, a lot of community interventions are still being made to demystify the myth that tuberculosis majorly affects those who are HIV positive.
From the prevalence survey, actually 83% were, the ones that were found to have TB didn't have HIV. So actually we should be preaching more about having testing among the HIV negative.
Just in case you're wondering how to avoid getting infected with TB,
Ni avoid overcrowding. Fungua milango na madirisha ili hewa iweze kuflow vizuri.
For now, Ezra is still continuing with his 6-month treatment, whereas Mark is set to complete his come this September. All in all, their story is being a drop in the ocean of what is the reality of tuberculosis in the country. Raquel Muigai, Citizen TV.